All right, good morning. Welcome to Jail Car. It is 9 o'clock and we're starting our regular meeting. I recommend we seat Representative Grota for Representative Hatch and Representative Hack and Phillips for Senator Whitley. And we have a quorum, so. Mhm. The minutes of the previous meeting.
Move to approve. Second.
Okay, moved by Representative Schmidt, seconded by Senator Lang. Are there any additions or corrections to the minutes? All right, seeing none, those in favor?
Aye.
Opposed? All right. The consent agenda, I'd like to remove the second item, the Board of Acupuncture Licensing, which was placed on consent in error.
Sorry.
Yes, Representative Land?
Thank you. I would actually like to remove HI RS&T, please.
Number is that?
Sorry, the FP 2022-240, the reimbursement for mileage. The FP 2023-2 dental services. And then the ones about the licensor surveys. There's one question removed from all of them that I have a question on. So those
Okay.
are EXRF 2023, 1, 2, and 4.
All right. Any other removals from consent? All right. Those in favor of approving the rest of the consent agenda, say aye.
Aye.
Opposed? All right. Director Morrell, should we deal with the off consent first, or do you think the?
We can do it either front or the back.
Whatever you prefer.
All right. Why don't we do the regular calendar first then? Because I think it's should be more straightforward. Town health officers.
I believe the town health officers was on the consent agenda. Was that removed?
Oh. The calendar I just got is, oh, forgive me. The immunization registry rules. Yes, that's a little different. Sorry, excuse me.
That's fine. I just want to make sure I didn't miss that one being removed.
No, that's all right.
So with regard to the immunization rules, that has not changed from the interim rule that was filed last year as 2022-5. The only reason it's on the regular agenda is because there was a number of comments on it when it was an interim rule, so we wanted to keep it on the regular agenda. And additionally, there were 2 notes to jail car on pages 2 and 3 of the rules regarding those forms that are mentioned. Those forms are not being updated in this particular rule, but the department has stated that they're in the rulemaking process to update those along with other rules in order to implement HB 1606, which I believe becomes effective this summer.
Good morning, Allison Radmay, Administrator of the Administrative Rules Unit for the Department of Health and Human Services. Just as Attorney Reichert had said, we are moving forward with revisions to HEP 307 and 301 to incorporate HB 1606 that does become effective this summer. We are still in the heavy drafting stages within the department, but we do expect to start rulemaking on that within the next few weeks.
So that I hope the intent is that those forms are, the updated forms are available before the
Yes.
start of school.
Yeah.
Okay. Any other questions or comments? Representative Leon?
Thank you, Madam Chair. I have a question about some of the wording on the form. I know it was approved previously, but it says that it's a request for a religious exemption. However, in our statutes, it's not a request, it's a right. And I'm concerned that stating it as a request would lead to some facilities not accepting this religious exemption. that is under the please specify the vaccines for which this exemption applies on the New Hampshire Child Care School immunization form or religious exemption form.
I'm not sure that
Good morning. My name is Anne Marie McCurry. I'm the immunization section chief for the department. I'm happy to answer any questions. I'm sorry, Representative Leon, I'm not sure exactly where you're specifying. Would you please clarify?
Thank you. If you have the school immunization form in front of you, when you look just above the check boxes for the various vaccines, it says on that line, your request for a religious exemption. A request implies that it can be rejected, but the law says that if you have a religious exemption, a child shall be exempt from immunization if the parent signs this form.
Sure.
We're okay with removing that if
Okay.
May I ask, is there a specific term that you would rather have in place?
I would just strike the words request for a religious exemption. So it says it will not impact your religious exemption. Because I appreciate those clarifying words because there are a big concern about those check boxes.
Thank you.
Okay. Any other questions or comments? Senator?
Move to approve as edited.
Second.
Okay. Further discussion? Motion to approve as edited. All in favor?
Aye.
Opposed? Okay, thank you very much.
Thank you.
No, different ones. All right, Board of Medicine.
Okay, so 2022-191 is on severance of connection and changes of address. You'll see in front of you is a one-page proposal. It's pretty short. The only reason why it's not on consent is because one of these rules has been expired since May of last year, and that's on the section regarding changes of address, which requires that applicants or licensees report changes of address within 30 days time, and that if mail is returned back to the board for a wrong address, the board will issue a letter of concern. Like I said, that's the only issue, is that the rules have been expired since last May.
Good morning, Tina Kelly, Office of Professional Licensure and Certification. What the board did for that section was relied on RSA 329:16-F, Roman numeral 1, which states exactly the same thing.
Okay, so were any doctors disciplined for not reporting a change of address?
Not that I'm aware of.
All right, Senator?
Move to approve.
Second.
Any discussion? All right, those in favor?
Aye.
Opposed? All right, we have that one. And, yes, licensure of regulated professions.
So for this particular item, 2022-209, the agency did file a conditional approval, which did address the majority of the comments. However, there were still some that were made, and additionally, some new comments that were made because the conditional approval included a universal initial licensure form, a universal temporary license form, a universal renewal form, and a form for temporary active military license applications, which could potentially conflict with boards that already have forms for these particular license. So there was a note to Jailcar on page 1 about that. One of the remaining comments from the FP is on page 1. It's an unclear note to Jailcar comment, as there seemed to be some overlap between the language in the particular section cited and PLC 213, which is disciplinary proceedings and license conditions. In the OPLE summary of comments, it is represented that there is little overlap between the two and that the OPLC will review what is currently in PLC 213 to see if anything should be moved to the 300s. The next comment is a unclear legislative intent comment on page 2 of the conditional approval text. They have at the very end of the requirements essentially an all-encompassing requirement that if is not listed will apply or need to be submitted if it's not listed in what is already in the text. That may cause some issues because they may be incorporating information from third parties, which would need incorporation by reference form, or they may require information that cannot be incorporated by reference on the form, but actually has to be stated in the rule text. This comment is also made for later in that section, B8, and additionally on page 25. On page 3 of the final proposal, and on page 1 of the conditional approval text, there's another note to jail car that the changed language includes disclosure of personal information for individuals and the email address for legal entities. Essentially, what the agency is saying is that the person or the entity, if they do not wish to disclose that information to the public, can indicate that on the form. However, this may conflict with RSA 91A. Should it go to a court, the court would implement a balancing test on the individual or the entity's right to privacy over the public interest. And at this time, it's staff's opinion that it may be too encompassing or too much of an overreach to deny the public that information. On page 3 of the conditional approval text, there is also an unclear comment, as there's a request on the in the text for the verification of licensures, but it's not seen on the form that was submitted to OLS. And finally, on page 9 of the final proposal text, the form requires that the applicant, the form that was submitted to OLS says that the requirement that is being asked for is for applicants of reciprocity only, but it's not clear in the rule text that that is the case. The rule text just says that that information should be provided, so there is some discrepancy between the form and the rule text.
Good morning, Madam Chair, members of the committee. For the record, Lindsey Courtney, I'm the Executive Director of OPLC. Just briefly, I think kind of a broad overview of what we're trying to do here would address some of the staff's comments. OPLC now has statutory authority over licensing procedures, and the boards have statutory authority over licensing criteria. All of the boards previously had statutory authority over procedures, and so they all had different forms, which has led to issues with respect to data and how we're managing our system. So what we are trying to do is come up with what we call a universal application with respect to procedures, or basically everything that the boards have on their own applications in different formats. So I call that page 1, and then page 2 will be whatever the specific criteria is that relates to that profession. In order to make this happen, we need to have page 1 in place first, and then we need to go back and modify page 2 to make sure that the board forms are limited to criteria. So certainly there will be a conflict, as this committee has seen, as OPLC has obtained additional legislative authority. It's the only way that we think we can actually manage it. So that's with respect to the first comment. With respect to the second comment in PLC 213, the 200s deal with disciplinary proceedings, which are very different from adjudicating licensing applications. We don't view it as a conflict. The reason why this is important is because in a licensing proceeding where somebody does not have a license, the burden is on the applicant to demonstrate why they qualify for licensure. In a disciplinary proceeding, the burden is on the prosecutor to show why the license there should be conditions on the license. So there's 2 separate proceedings, and I don't view that as a conflict. With respect to, I think it was page 25, it's also on page 1 with respect to disclosure of personal information. The Department of Justice has taken the position and has advised all agencies, including ours, that email addresses are confidential. And so therefore, we do not, as a matter of course, disclose email addresses. However, it has been a longstanding practice for many of our boards to give out email addresses to associations. What we are trying to do is allow individuals to consent, and we believe that it's their right to consent to disclosure of their private information. And if they choose to consent to disclosure, we would release that information. If they choose not to consent to disclosure, we would not release that information. Yes.
This is relevant to email addresses only and not mail addresses.
They could consent under the proposed rules to mail addresses as well.
Isn't that public information that they're?
We've been advised that from our perspective, DOJ has advised us that personal mailing addresses are confidential, business mailing addresses are not. So we do give out business mailing addresses, but the problem is, going back to page 1, the boards have collected this information in different ways. So we can't do a data export to really provide that information in a user accessible format. So we'd like to create a scenario where we are capturing both personal and business. And if individuals want to consent to disclosure of personal information for whatever reason, they can do that.
Okay, I see some baffled looks, but no specific questions, so please continue.
Okay. So regarding the comment that OPLC is requesting that individuals submit basically any other documentation that is otherwise required, that goes back to the page 1 versus page 2. We cannot reasonably be expected to list everything that any licensed professional would ever be required to submit according to the board rules on this page 1 application. So what we're saying is that you have to follow page 1 and then you have to follow page 2, whatever that may be. And unfortunately, because we have so many license types, we can't list all of those page 2s. And then finally, with respect to reciprocity only, I would agree with that comment that we can certainly make that change, that the requirement to submit a verification of licensure in another state clearly only applies to those seeking licensure by endorsement or reciprocity.
Could you confirm that when you're granting a license by reciprocity, you confirm that the requirements from that other state are substantially similar?
It depends on the statutory mechanism under which the license is granted. So there are many different reciprocity applications that we have. For those, and I just did this with funeral the other day, for those who are seeking licensure under 332G's analysis that require substantial equivalency, we do require that the board make a determination that the requirements are substantially equivalent before we issue the license. Some boards already have in rules a reciprocity-based mechanism for obtaining a license, and the statutory authority for that is not 332G, and so therefore we follow that process in those rules.
Okay, but in general, you do verify that they meet the minimum requirements.
Oh, absolutely, absolutely.
Thank you. I had some questions from people as to whether that was the case, so I wanted to confirm it.
Yes.
Okay. Anyone else? Yes, Representative Grota.
So along with the information that is collected on those people, individuals' licenses, are there social security numbers, I would think, correct?
Yes, it's a requirement of state law, which is incorporating federal law, which dates back to child support obligations, that we are required to collect social security numbers on all licensing applications.
So how does one protect that information when people say you can distribute my information? How is it that just that process is selected and social security numbers aren't sent flying around?
Oh, yes. No, that's a very good question. So, if we're doing a data export, we would export particular data fields that obviously would not include social security numbers. And we always have two people check the data fields to make sure that they are accurate data fields.
And you do have the option of individuals not consenting to share their data.
We have the option of individuals not consenting, or yes, if individuals don't consent to disclosure of confidential information, we don't disclose that. And right now, we don't have a mechanism for people to consent, so we aren't disclosing anything, which has actually caused problems with some of our friends and stakeholders because they have always received this data in the past. So we'd like to provide that opportunity for people to consent, but right now we're not disclosing anything. Now, if it's public information under 91A, obviously we certainly do disclose that information, but that's typically name and license number.
All right, thank you, Representative Schmidt.
Thank you, Madam Chair. So in the past, some of the county registries, I think all of them, as a matter of fact, included social security numbers in their records, and then a number of them have gone online.
Yes.
And that stuff became searchable, and it became a problem because the social security numbers are right out there in the open. I think most of them have taken steps to try to stop that. And I'm wondering whether your files, any of them are searchable online, and thus you would have a similar problem with them if you're requiring the social security numbers.
We do have an online system, and DOIT has fully vetted it. It's been online for years. You can search for individuals' licenses, but Social Security is not the data that's published.
Okay.
Okay.
Thank you. Good to know.
Other questions? Okay. Please continue.
Those were all my comments in response to the staff comments.
Okay.
Fellows is on the board. You should be up to it.
Should I sit up there?
Yes.
Absolutely, you're on the board.
So I'm Sally Fellows, State Representative for Grafton 8. My first question has to do with the use of the portal to file an application. It seems to be the only option that's available. So my concern is that there are a lot of people that might be applying for a license that only have a cell phone to use. They don't have a computer. Some of the applications require that they write a narrative about their experience, and to try to do that on a cell phone would be really difficult. Plus, I assume that you want them to upload transcripts, things like that, and then they would need a printer with a scanner. So it appears to me from what I saw in the proposed rules that you've eliminated the paper option. Can you address that?
Yes. We presently only conduct renewals online. So for the large majority of our 200 and something thousand licensees, they're only renewing their license online through the portal. We have a kiosk, and people readily, they typically will make appointments with their staff and we'll walk them through it. As this committee is aware, we are currently upgrading our system. We'll be mobile friendly. So those individuals who have cell phones will be able to apply online through an app, take pictures of their documentation and upload. It's what people who are entering the workforce and applying for new licenses now are essentially demanding, because that's how they're conducting all of their businesses. Additionally, we have found that that is the way for us to be most efficient. I recognize that for all people, it's not going to be one size fits all, which is why we have the kiosk option. But in terms of manual data entry, that requires a significant amount of time of staff time that the licensing portal will eliminate by receiving applications electronically. It'll also eliminate the opportunity for errors. So in the rollout of the renewal process, we haven't observed any significant issues with that. Obviously, some people are not fans, but for the most part, it's gone off without a hitch, and it's been using a portal that is ancient. So I suspect with a new portal, it'll even be better.
Follow up.
So the current rules do say that there can be a paper application, so have not been making that available.
We have paper applications in the office if for whatever reason somebody demands a paper application, but our experience has been that when we walk people through the process and educate them, that they much prefer the electronic process.
Okay.
So
I think it is important to maintain a paper option, at least till you get your app up and running, because there are some old fogies out there who prefer not to do it on cell phones. And I believe there are also some boards that require substantial amounts of paper in addition to the form. So for those boards in particular, we would want to have an option.
Yeah, so we have to maintain our paper documentation if for nothing else other than continuity of operations. If our system we're shut down, we need our documentation. I would say that we're happy to continue to offer that as a customer service option. That said, it does come at an increased cost in terms of additional staff support. So that's something that I think the committee should be aware. Vermont has a similar process, and they are able to issue licenses in 24 hours. And so from a workforce standpoint, when people are submitting things via snail mail, we are not able to do that. And if we want to be competitive with our neighboring states in terms of how quickly we turn around licensing applications, I think that the electronic application is the way to go.
Senator Lang?
So I just want to be clear and summarize all that conversation. So in short, people can file online if they wanted.
Yes,
They can come into your office and you have staff to help them if they want to file online using a kiosk that's available to them in your office.
correct,
And the third, you also have paper available if someone comes in your office and wants to apply by paper.
correct.
Thank you.
Okay. And I do hope that as we're streamlining the boards, that we simplify the amount of specific paper that needs to be handled.
So
Representative Fellows?
and I'm doing this correctly. So will the rules be amended to identify the fact that a paper option is still available? Because right now there's a cross-out line through that.
What I would suggest, if that is the committee's desire, I would suggest language to the effect of the paper application shall be made available when an electronic version is not practicable. And the reason why I'd like that language is because when we started rolling out the renewals for cosmetology, cosmetologists have always done everything via paper. They were not happy about having to move to the electronic format. But once we got them there, it's working, and now we're seeing greater compliance with licensure renewal. Cosmetologists had a history and a penchant of just letting their licenses lapse and then coming back 2 years later and paying the extra $5 and we want people to try it, and that's why I would ask for that language when you give them the option. I think what we'll see is that maybe 20-30% will choose paper, and from a staffing perspective, that's not something that it can easily be managed.
Okay, thank you. Other questions or comments? Representative Fellows?
So thank you, and I hope that you'll want to be a customer-friendly agency and make that known on the website that they do have that option if the portal doesn't work, if they don't think they can use the portal, that it's obvious to them. So I had a question about the conversation that we just had about the addresses, and I'm wondering if I wanted to look up somebody's license and they had a fairly common name, wouldn't I need to see their address or a part of the town to know if that's, or at least the town to know if that's the person I'm thinking about? You know, Mary Smith, you know, is she licensed?
Yeah, I mean, I think, we take protecting people's private information very seriously. And so we could certainly have the conversation about whether providing the town is sufficiently deaggregated. Um, but that has not been an issue that has been raised to us in the past. So we have not made it a practice of publicizing people's portions of people's addresses. Typically, people rely on a license number. When they go to visit a licensed professional, almost all boards require that a license be displayed, and there's a number associated with that, which is a public identifier.
Okay, thank you. Representative Fellows and then Representative Lamb.
So I'm just thinking of a perspective from the person who wants to know, does so-and-so have a license for this? That I thought that your portal, well, whatever. I know I can go to the website and I can look up somebody's name under a specific certification. And I'm just, isn't that part of your job so people will know if somebody's licensed or not?
Yes,
They want
part
to
of
find that out. So how do they know that if they don't have some kind of address?
again, I think most people, if you go to, for example, a salon, they are required, mandated to.
It's not what I'm asking. I'm asking if I want to know ahead of time, is so-and-so licensed as whatever?
Yeah, we provide that information online.
The town.
We do not provide the town because, again, DOJ, the Attorney General's office, has advised us that releasing addresses, personal addresses, and again, we don't have a mechanism right now to differentiate between business or personal addresses, that releasing that information is considered confidential and not subject to 91A. Now, I would agree with you that perhaps releasing just the town may not be subject, may be sufficiently deaggregated. Practically, I don't know whether DOIT, and again, it's not an OPLC system, it's an enterprise solution that is extremely ancient, could do a data extract that's limited just to the county. Maybe we could. We've never had this issue raised because typically people have the license number and they're able to verify that information through that specific identifier.
But if there were a case where you wanted to verify before you got into business with this person, could you say, well, is Bob Williams of Lebanon a licensed electrician?
Yes, correct.
We would be able to call up the office, assuming there's 17 Bob Williams in the state, and say, is this person a licensed electrician?
Yes, you can even request a letter of verification if you want it.
Okay, thank you. Does that help?
Yes.
Okay. Any, Representative Lamb?
Yeah, so I just want to make sure that I'm understanding. I thought you had said earlier that the place of business of the licensee is public.
It is considered public information. It's not something that we publicize because from a technological standpoint, the boards have not always consistently captured that. And so that's what page 1 is trying to address, to make sure that we are capturing the same data set for everybody so that we can make agency-wide decisions as to what can be posted and what can't be posted. When the portal was established, all of the boards were operating on their own. And so they came up with their own demographics and they came up with their own address requirements. And they came up with, do you capitalize, do you not capitalize? And by virtue of that, there's no way for us to consistently distinguish between business and personal in the portal. And that's why we just don't extract any of that information, because we can't confirm that it is business versus personal.
Okay, but couldn't you say on page 1 of the portal, list your business address? I mean, what would be the problem with that? List your business address, and then they list their business address.
Well, that's what this is exactly intended to allow us to do. We need that application first to capture that information, and then we fully anticipate being able to release the business address. But we don't have that capacity right now.
Right, okay, I see what you're saying. But you're planning to do that.
Yes,
All right.
yes.
Senator Lang?
Move to conditionally approve with staff edits and comments made today.
Is there a second? Seconded by Representative Ennis. Oh, Senator Ennis, excuse me. Those in favor?
Aye.
Opposed? All right. Thank you very much. And while we're into licensed professions, why don't we take up the acupuncture licensing and fees that came out off consent, if that's yeah, that's final proposal 2022-170 ACP 300.
So, this is a little confusing. We had some mistakes with this one. It is on acupuncture licensing, and I think I understood from the executive director that this would be page 2. Okay. So there actually is just one very minor editorial comment on the form. What happened with this is the staff at the agency filed the final proposal appropriately. And then we had some issues with GelCar staff. There was a typo in our database. And because that can happen, the database is old and quite difficult to use sometime. We have kind of a second layer. And so the staff puts in the numbers so that we can pull like reports and stuff. And then they forward the attorneys the information. And there was a typo. And so the second layer is the emails. And I believe that I accidentally deleted the email. And so we didn't get the timing correctly. So technically, this has already been approved like a pocket approval because we missed the deadline. But I think you did get a waiver, right?
We had a waiver on Monday, which according to the director was approved prior to the time
Deadline.
the rule would go into effect without GelCar meeting on it.
Okay. But so that's the weird thing happening with this. But other than that, there's nothing wrong with the rule. So
Well, that's so nice to hear. Any
also,
questions or comments?
I have implemented a new system for my email so that I don't do that again.
Senator,
Move to approve.
any discussion? Seeing none, those in favor?
Aye.
Opposed? All right, thank you very much.
Thank you.
All right, and
Going back to the regular calendar.
back to the EMS, and then the things that came off consent.
Okay, so 2023-11 on EMS Letters of Concern and Denial. This proposal makes changes to the rules on emergency medical services, and it inserts a definition and criteria for when the commissioner will issue letters of concern for when an EMS worker has committed an act or offense in violation of the statute. And there are 3 main issues to discuss, and I'll take each one in turn. The first one is on page 5 of the linked PDF, which is page 1 of the rule proposal. And you'll see that comment on the upper left-hand corner. So the department was previously in regular rulemaking with this rule set and missed the final proposal deadline. They did enter into interim rulemaking, which was approved and adopted, but those rules have expired as of November. So what you're seeing is on that first section there, that applies to the letter of concern definition, that has been expired since November. So that's the first issue to bring to your attention. The second one is on the same page. You'll see a comment in the middle of the page. It says public interest / potentially inadequate FIS. So here, the agency has inserted a new section, a new amendment, if you will. So 5908.01 was not included in the notice, and it was not included, in the initial proposal. So, which means that it wasn't submitted over to the LBA, and like I said, it wasn't included in the notice. The changes here are highlighted, so you'll see what changes they made to that section. The changes are minor and they are in line with the rest of what they're doing in this proposal. There may not be a cost, I don't know, but you may be concerned about any associated cost, and you might be concerned about the lack of notice to the public for changes made to this particular section. I can go on to the next one, but if you want me to stop there, and we can do that.
Yeah, why don't we hear from the agency on this one?
Hey, Aaron Johnson. Right. Hi, Aaron Johnson, Rules Coordinator on behalf of safety. So with that, we actually did reference the notice. We pointed out in the first line of the notice that RSA 153A 13.1 basically talks about letters of concern and the rulemaking authority that we have over them. And pretty much what happened here is in the process between the initial proposal and the final proposal, we realized that there was a little bit of ambiguity where there could have been a potential cost that wasn't calculated, when in fact that was never safety's intent, to where in 5908.01, if we look through it, it's basically saying the commissioner shall not impose both a fine and any of the other things. Originally, it was just a revocation or a suspension. That was also supposed to include a letter of concern.
I'm afraid that doesn't quite make sense. So the statute, as I recall, when we passed it, added a letter of concern as among the options available for discipline. Is that correct?
Correct.
Okay. So that this rulemaking is amending your rules to allow a letter of concern in addition to the fine and license denial and so forth that was already in statute and rules. Is that correct?
It's not it's adding an option to be a letter of concern, but it's not imposing both an option or a fine and a letter.
Right.
of
It's
concern.
adding among the discipline options the letter of concern as well as the fine and the license denial that was already in statute and rules.
Correct.
Thank you. That makes a little more sense. Anyone else have a question? All right. Thank you.
Okay, so the last comment, and it's they're related, so I'll take them together. You'll see on pages 8 and 9 at the bottom of page 8, and that is going to be, that's page 8 on the linked PDF at page 4, the rule, down at the bottom of page 8, and then at the top of page 9. I'll take these together because they're kind of similar. So this section of the rule is talking about suspensions of licenses. And the reason why we have a comment here is because basically the rule lacks criteria to describe for when a deferment of a suspension or when a rescission of that suspension will be granted or not. So basically the rule says that a suspension may be deferred for up to 1 year conditioned upon good behavior and completion of any requirements that need to be met, but it doesn't describe how the agency will decide to do that, what criteria it's going to weigh in order to defer that suspension or not. And that's basically the same issue on the next page regarding when the agency will rescind that suspension. The rule says that the suspension may be rescinded upon the licensee's correction of the violation, but it doesn't say that it definitely shall be. And it doesn't give us any criteria to know, or for the public to know, how that decision is going to be made if they correct the violation.
So the criteria is actually listed in 5922.11, and that's going to be on page 6 of the final proposal.
Okay, here it talks about suspension, and it lists all the various reasons for the suspension. But like I said, it's not, giving us when, if I, as a licensee, correct my violation, The rule doesn't say that suspension will definitely be rescinded or deferred.
Good morning. My name is Jeffrey Phillips. I'm the Assistant Director at the Fire Academy and EMS. I guess the operational tack that we've always done is 592211, which outlines the criteria for the actual sanction, and also the level of disciplinary action. So we typically will, if we issue a suspension, depending on the severity outlined in 592211, we'll determine whether the suspension can be deferred, whether it goes into place. At this time, there's been no suspensions that I'm aware of or revocations I've been aware of that have been rescinded. But essentially, the criteria that's outlined in 5922 is utilized for both the level of sanction and also the level of discipline assessed.
Senator Lang?
So as I look at 2211 there, I'm assuming that the things in here, you have the mitigated and extenuating circumstances. So things that are presented, the cooperation of the individual or the agency being suspended. These are the kind of things that will alter possibly remove the concerns from above about the criteria, right? That you'll use those considerations to say, all right, you've resolved all the issues, you cooperated with you took responsibilities, so therefore we're going to lift your suspension.
Correct. And it also depends on what the infraction is. You know what I mean? Because I'm in the world of EMS, no two calls are the same. So it really, whatever the mitigating factors of the specific incident, if it's a protocol violation, really depends on the severity of a protocol violation. So really the totality of the investigation of the cooperation of the service or the unit or the provider in regards to the individual instances of the specifics of the actual call or instance are all taken in consideration in regards to that specific.
Thank you.
Director?
I understand that the intent of 592211 is to apply to rescinding the action too, but it says in imposing any sanctions under this part. So it's only talking about imposing sanctions. It's not about rescinding a sanction.
And it doesn't specifically address when it will be suspended, although, you know, clearly you can look at that and say, well, this one is likely to be suspended, but it doesn't seem to address that issue either.
Correct. Even though the criteria are there in 592211, the other rule still says may. So regardless of the criteria, the department's leaving itself the option to do it or not.
Representative Lynn?
Yeah, I guess I agree with the way you read it, but I'm not. What's the problem with that? I mean, is the idea that the department shouldn't have any discretion?
No, they absolutely can have discretion. It's just we don't know when it's going to be applied or not. There must be some other factor if they're saying may. I mean, they seem to list criteria in that rule, but they're not saying they shall do that if you meet that criteria. They're still saying that they might do it.
Well, but I mean, I guess the concern I have is the more you try to subscribe in by saying this factor and this factor, I mean, you're really sort of limiting their discretion. I mean, that's.
The rulemaking manual addresses this issue. It tells what you have to do with criteria. You have where you can't list all the criteria. There are things that you might not consider but would apply in an individual case. You're allowed to specify examples of criteria, 2 or 3, and then have a catch-all at the end that would apply to anything else that's unstated. You also can have just a simple general criterion, which they seem to have in those individual rules in 592204 B and C, but they're still not saying shall. They're saying may be deferred. may be rescinded.
Right, and 541A 22 does state that no rule is enforceable unless it's been filed and adopted. And so, in essence, what this would amount to is oral rulemaking that can't be enforced if it's outside of, like what the director was saying, if they had some kind of catch-all or a general category of how those decisions would be made, then that would clarify the issue.
Director?
However, the committee's not required to object. If they feel that this is going to be applied uniformly and it gives adequate criteria based on the other section, then you can do what you will.
Senator?
Thank you. So I know Representative Lynn's judge is coming out a little bit, but I tend to agree with him. I think as you read 2211, when it talks about the following factors to determine the level of disciplinary and sanctions imposed and the duration of the disciplinary sanctions. So that seems to me to say that this is the criteria that will basically affect your sentence, for lack of a better phrase for the judge, is that this is the criteria that'll affect your sentence. So they can say cleanly in a disciplinary action saying, this is the sanction. However, if you make these corrections, we can lift that sanction. And that's the sentence, right? So that's their sentence, so to speak. So I think it's clear myself. I think it gives them appropriate discretion so that a one-time offender isn't treated as a murderer, so to speak. And so I think it's clear myself. I think it gives them the proper amount of discretion given the factors that will impact the sentence for the disciplinary action.
And would the actual sanction indicate any criteria for revocation or suspension, so that this is suspended for 3 months while you take a class, or this will be suspended unless you do something else? Is that generally in the letter of sanction?
Yes, when we issue a letter, a finding letter, first of all, the individual has 10 days to appeal through the Bureau of Hearings at the Department of Safety. But additionally, it outlines the criteria in regards to what the sanction is and if there are any corrective action requirements, additional training. Most of the time is actually additional training. A specific instance where they didn't do a procedure properly, we would require additional training. And that could change it from we would defer the suspension for a certain amount of time until that training was done. If they didn't meet that criteria when the training was done, then the suspension would go, like a full suspension would go into effect.
Thank you. Questions? All right. Is there a motion?
Move to approve with staff edits.
Second.
All right. Any further comments or questions? Okay, those in favor?
Aye.
Opposed? All right, thank you very much. So that leaves us with the items off consent. The reimbursement for mileage.
So this is the reimbursement for mileage for SNAP participants who are doing employment and training. And I have no comments on the rules.
Representative Leon?
Thank you, Madam Chair. Reviewing this, it speaks to reimbursement for public transportation, including but not limited to taxi rides, bus passes, and ride sharing. I'm just concerned about how taxi rides are public transportation, especially because they can be a more expensive solution. And I'm just curious as to where that allowance is.
Good morning. My name is Nicole Valenzola. I'm the rules coordinator over at the Department of Health and Human Services. I do not have a program area expert with me today due to the rule being on consent originally. So I don't have that specific answer for you. I can definitely ask them and get an answer back to the committee. I know that, we did look at this. We went through because I actually pointed out more so that taxis seemed outdated. And so I was like, are you including Uber or something? So that piece was talked about, at least from a noticing it perspective, and they didn't raise any potential for concern or anything.
Yes, please do get back to us on that. The deadline is not till after our next meeting, so we will postpone this until our next meeting.
Madam
Okay.
Chair,
Yes.
if I could just add a comment. So I live in the Upper Valley where there is some advanced transit available to our community, but of course there are pretty rural areas as well where there are no Uber services in the Upper Valley, or at least not since COVID. And so I think taxi services are the only remaining option for many people trying to get to DHMC, for instance, for appointments. So I know that that is probably the only viable transportation option if they don't have a vehicle and are homebound or have this temporary disability given a healthcare issue. So I just wanted to back up the department that I know that is a readily available and probably the only option for many folks in the Upper Valley.
Senator Lang?
I'd echo the same thing, and I think we've capped it with the number 3 right behind it. It says there's a $100 limit per month. So regardless of the transportation services used, you're still capped at $100 a month. And I know in my district, Laconia, same problem. We don't have public transportation. We do have taxi service, we do have Uber, but we don't have public transportation. It would be the only way someone could get around if they didn't have their own car.
Okay. Representative Fellows?
Yeah, just to add along that line, I mean, some people may be handicapped and there may be public transportation, but that could be difficult for them. So,
All right, thank you. Representative Lamb?
Thank you. I have better understanding about why that's a need. And so with this, I don't object to that anymore.
Would you move to approve?
Yes, I'd move to approve.
Okay, any further discussion?
Thank you.
All right, seeing none, those in favor?
Aye.
Opposed? Okay, thank you very much. The dental services.
So on this particular item, the only comments I had were editorial in nature, which is why it was originally on the consent list. But essentially what this rule is doing is, first off, there was an update to the code maintenance committee of the American Dental Association and how they code limited orthodontics and interceptive orthodontics. Before they were separate, now they're combined. So that change was made to replace interceptive orthodontics with limited orthodontics only. The other change is as a result of the HB 103, which is amending RSA 285 to extend dental benefits under Medicaid managed care programs to individuals 21 and older, which became effective on July 1st, 2022. This particular rule only removes a particular requirement that was needed before in order to be eligible for dental care under Medicaid if you were 21 and older. But that was the only change made to these rules. What the notice states is that the implementation of HB 103 is going to be done by adding a new section to HEW 506 entitled Medicaid Care Management, and the department's in the process of doing that. So that was the only changes to these rules.
Thank you. Representative Lamb?
Thank you, Madam Chair. I was looking to clarify, we had expanded services for the developmental disability, acquired brain injury, and the CFI, the independent living groups for the removable prosthodontics. And I just wanted to make sure that that wasn't being expanded to everybody 21 plus, because that was intended to be a benefit just for those communities. Is that part of the rulemaking that is coming further from HB 103?
I think the department can better answer that, but based on what I'm reading, these rules don't really touch on the dental requirements for 21 and older. It just had one sentence with that strike through in it. So I would leave the department to further answer your question on that.
Good morning, Allison Radmay. I'm administrator for the Department of Health and Human Services, the Administrative Rules Unit. Again, this rule was on the consent calendar, so our Medicaid dental director is at another place at this time. I can bring any questions back to her. With respect to HEW 506, we actually just had our public hearing on that this past week, and unfortunately I don't have that file with me here. It's actually on my desk. So I can't speak to what's currently in that right now, where it's not in front of me.
Okay. Yes.
I'm not sure if it would make sense, the deadlines after our next meeting, just to make sure that we're not extending that, or I guess I'm looking for guidance. I apologize for pulling these off consent at the last minute. I'm still learning the ropes, and I didn't want to let something go by unquestioned when I had a question.
Representative, excuse me, Senator Line.
Yeah, it's okay, whatever. So, so just to be clear, the only real change in this rule from the previous rule was due to a coding and billing issue with the dental association, and that this change is to take into account those billing requirements so that we don't have a gap.
Correct.
And the new rules that Representative Leon is concerned with are in the process.
Correct.
And they're
yes.
not
We
included
expect
here.
those to be in front of you probably May.
Thank you. And since it went to public hearing this week, the rule itself and any data from the public hearing is probably available.
And we did not, nobody attended our public hearing.
Oh,
So, bummer.
how sad. Representative Hacken Phillips? No? Okay. Anyone else? All right. Do we have a motion?
Move to approve.
Second.
Okay. Discussion?
Thank you.
Those in favor?
Aye.
Opposed? All right. Thank you. Is that it?
There were 3 others that were the expedited revisions to the licensure surveys for physicians, dental hygienists, and the psychologists. It was one question in common for all of those forms.
Okay.
Thank you. My question was that it was removing the language on all of those that asked if this location was owned by a hospital system. That seems to be a really important data point for the department and for others to have, because the dynamics of hospital owned versus independently owned are different. And I'm just curious if those data are otherwise available, and why that section has been removed from all 3 forms.
Nicole Valenzola again, Department of Health and Human Services, Rules Coordinator. I can most certainly take that question back to the program area expert. So could you just repeat it again though? Because I thought I would maybe be able to answer off the top of my head, but I cannot.
Yes. So
The
all 3 of
hospital.
them have a question that is struck on, let's see, it's on the first one for physicians. It's question number 22.
Could you tell me the notice number?
Yes,
2023?
2023-1.
Okay. Which
On-
page again?
On that, I'll pull up the page, but I know it was question number 22.
Oh, question 22. Thank you.
It's on page 8, Nicole.
Thank you. 22. Oh, the 22 that was struck through, not the new 22.
Correct.
Okay.
And that has been struck from all 3 of those forms.
Probably for the same reason.
Maybe, I don't know. I'll find out for sure.
Thank you.
Why? And then you were saying that you believe that this is important data, so is it available elsewhere?
Yes, if it's already collected, it doesn't, not sure that it needs to be in the licensure, but that is very important because it changes, it impacts the dynamics of our healthcare system. All right, and actually on the physicians, I did have the question about why we're getting rid of some of the specialties. Gynecologic oncology, hematologic oncology have been consolidated into oncology. I'll pull up which page that is.
I just need the notice
apologize.
number again.
Yes, that one is the same 2023-1. And when you get to page 6 of the form, it's the area of practice. And gynecologic oncology is struck. Oncology and hematology oncology is struck so that it's just hematology. So all of oncology is put into one section that's been added down below. And then when you get to page 7 on the surgery subspecialties, all of those subspecialties have been removed, and there's just the general basket for surgery subspecialties. And knowing that access to care and having care here in New Hampshire is important, I'm just curious why those data are being removed from these surveys.
With respect to page 6, the gynecologic oncology and the hematology and oncology, but including oncology as a one catch-all beneath, just a question as to why that was done that way?
Yes, I'm curious to why
Versus
that's removed because
why separated?
gynecologic oncology, there's a lot of specific needs with that. And I think that's an important one to call out, although I appreciate that perhaps you're just consolidating them into tighter buckets so that you don't have some details without others.
Okay. I have a question for, oh, sorry, Attorney Morales, like Mike. With expedited revision to forms, typically this would be now moved to adopt, it was on consent, moved to adopt, and then it goes in place. And I know they have deadlines with respect to getting these surveys out. And so I guess I don't know about when, I know you're talking about like the next gel car or something, and that might be a concern.
If the committee wished, this could be postponed. There is no deadline for committee action on expedited revisions to form. So if the department concurs, then, well, it's up to the committee, but I don't know if that would cause any heartburn with the department as far as time.
I know that there are some of these that need to go active April 1. And so I don't, sorry.
Oh, right. That's what they're talking about, yes.
If you approve and the agency brings back the information you want and Gelcart dislikes it, you could then petition to have them change the forms again.
Acceptable?
That's acceptable.
Okay, thank you. And is there a motion to approve then?
I'll move.
Well, we have to do, can we do all three of them, or do we have to do an individual?
I'm sorry, just again, so, because the clarification for all three of them was the question. I have notes
About
everywhere
hospital
now.
ownership.
Thank you. I started writing the age, but.
Okay.
So, Madam Chair, I move to approve EXRF 23-1.
All right, any discussion? Representative, Director Phillips.
If the committee wishes, it could do all three at once.
Oh, then
We're
I'll-
good.
23-1, 2, and 4.
All right. Any further discussion?
I'm sorry, I've sort of lost track of as to what we're doing. So
The motion is to approve all three of these expedited deletion updates with the request that the department get back to us and the plan that if we don't like their answer, we will petition for them to do another revision of the form.
thank you.
Any other questions, comments? Those in favor?
Aye.
Opposed?
Did we have a second on that?
Senator Innes.
Okay.
Thank you.
Right. Is there anything else that we need to cover? Cancel the continued meeting?
We have nothing else.
Okay. In that case, we are adjourned and the continued meeting is canceled. Thank you all.
And if anybody's interested, I hear finance is having a riveting conversation about HB2.